Good afternoon, clinical instructor. I am Amita Skipot from BSN 3C, and I am here to perform about the procedure of the surgical gowning and sterile gloving. So, what is the rationale of performing this procedure? Sterile gowns and gloves are worn to prevent the migration of microbes from the skin and scrub attire of the sterile team member to the sterile field. And the purpose of gowning is to prevent contamination to the surgical wound and help control infection via aseptic principle. The purpose also of sterile gloving is this would help to prevent the surgical site infection and reduce the risk of exposure to blood and body fluid pathogens for the healthcare worker. And to prepare the gown and gloves, allow the circulating nurse to open the outer package of the sterile gown and gloves. Open inner packaging, touching only the flaps of the linen, or allow the circulating nurse to open the packaging using a sterile forceps. Open the packaging flap in correct direction. Picks up the gown beneath the neck band at the armholes. Avoid touching the sterile field and the outer surface of the gown. Hold all the folded layers of the gown to avoid it from dangling and rubbing against the unsterile surface. Move away from the table while holding the gown from the body at arm's length. Allows the gown to unfold from the top going down, and ensure that the gown does not touch the floor or any unsterile object. Holds the gown just below the neck band and grasping the inside shoulder seams. Open the gown with the armhole facing self and slide arms past the way into the sleeves of the gown. Keeps hands at shoulder level away from the body. Ask or obtain assistance of the circulating nurse. Bends sideways for the circulating nurse to grasp the tie or offer end of the ties to the circulating nurse. Slides arm further into the gown sleeves and ensure that no part of the band protrudes from the sleeves cuffs. Grasp the inside seam of the juncture of the gown sleeve and cuff using thumb and index. Next procedure would be the donning of sterile gloves. Open the inner sterile glove package with the hand cover by the sterile gown and cuffs. Pick up the first glove by the cuff and start gloving the non-dominant hand first. Position the glove on the forearm with the cuff facing the hand. Gloves the finger towards the elbow. Places the glove's rolled cuff edge at the seam that connects the sleeve to the gown cuff. Grasp the bottom rolled cuff edge of the glove with the thumb and index finger. Grasp the uppermost edge of the glove cuff with the opposite hand while holding the glove hand, and avoid exposing the bare fingers. He stretches the cuff of the glove over the hand while grasping the glove, and grasp both cuff and sleeve cuff seam using the opposite sleeve covered hand. Pulls the glove onto the hand and pulls any excessive amount of gown sleeve from underneath the cuff of the glove. Put the second glove in the same manner using the hand that is now gloved. Ensure that no part of the skin has touched the outside surface of the gloves when gloving is completed. Check to make sure that each gown cuff is secured and covered completely by the cuff of the glove, and adjust the fingers of the glove as necessary to fit snugly. Grasp the gown near the neckband using the thumb and index finger of each hand. Rolls the gown so that the outside surface is over the glove hand. Ensure that the armholes of the gown are facing the team member being gowned. Offer the inside of the gown to scrabble the team member. Allow the scrub team member to slip his arm into the sleeves. Prepare the right glove by unfolding the glove's cuff and introduce air into the gloves. Avoid blowing into the gloves and grasp the right glove firmly at waist level. Keep thumb extended outwards and the finger covered by the glove cuff. Stand with one foot forward and one foot to the rear while stretching the glove open. Bring the glove upward gently over the cuff of the gown and repeat same technique for the next hand. Next procedure would be the removing the gowns and gloves. Allow the circulating nurse to untie the neck and back ties. Grasp the gown at the shoulder. Pull the gown forward and down over the arms and glove hands. Position arms away from the body and fold the gown so that the outside of the gown is folded. Discard gown into the linen hamper and grasp the outer surface of one glove with the other glove hand and pulls off the glove. Place the finger of the ungloved hand inside the cuff of the glove hand and pulls off the glove. Discard the glove into the designated receptacle.